And then I will show you some of the applications that we have developed on the field of healthcare, which is one of the fields that we work on. So the University of Antioquia is one of the oldest. It's actually the oldest university. It was founded in 1903 in Colombia. It has nearly 39,000 students, almost 40,000 students. It has 82 undergraduate programs and more than 100 graduate programs. It's located at the northeast coast in Colombia. So if we see Latin America, this is Latin America, this is Colombia, and this is one of the regions or states as we divided our country, which is called Antioquia, which is a region. And then in that region, we have another 11 areas where we take our teaching and research projects in the area. So the university constitutes by 14 faculties, or as you call it, schools of engineering, medicine. So we have arts, agricultural science, economics, healthcare is one of the largest schools and faculties in the university. We have 4 schools in languages, Inter-American Studies, microbiology. We have 4 institutes in different fields of knowledge, and then we have 3 corporations that actually work with the community in the region. About the Faculty of Engineering is the largest faculty in the university. It has nearly 9,000 students. It has almost 200 full-time professors, but then we have other professors that work half-time of middle time. And then we have around 17 undergraduate programs. We also have postgraduate programs. We have around 36 research groups in the different fields of engineering. This is biotechnology, environmental, electronical, mechanical engineering. And then we have these academic programs at the bachelor's or undergraduate programs. These are some of the fields in engineering. Bioengineer, environmental engineer is one of the strongest schools and engineering programs in the faculty. We have industrial engineer where we work and we offer different programs. Materials engineer, mechanical, and different 17 programs at the undergraduate level. We also have this kind of education which is a specialization where people want to improve their knowledge in a specific field. We have finance, preparation, and projects. We have logistics management and supply chain management as well. And then we have the master's degree in different engineering fields as a research master's program, but also as a professionalization master's program. And then we have the doctorate degrees, which are kind of new. We have less than 20 years in the doctorate programs, and this is one of the fields and opportunities that we want to explore. Now, we work at the Department of Industrial Engineer that I was saying is our equivalent from production engineering. We have nearly 1,200 students. We are 18 professors. And we have 7 academic programs from the bachelor's degree in different regions and also by internet or open web programs. Yes, online programs. So as in a similar way, we have 3 academic areas. We have operations, management, and logistics. We have quantitative methods specifically applied to support decisions in logistics and on finance and organizations management. We have these 4 research groups, constitute research groups. This is the work that I belong to, that I work with. The acronym comes from the Innovation and Cadenas de Abastecimiento, which is supply chain management and innovation. HESTA, I just brought the name as is in Spanish. I didn't want it to change it. Is on entrepreneurship and to form new companies. We also have a quality management group that has an active work with the industry, working for quality projects. And we have this Engineering and Society, which is a group focused on studying how engineers interact with the society. So this is the department. And from the department, I will show you how the supply chain management works. So this is our group. The acronym is INCA. This is us. This is recently the professors that we have. We are focused on supply chain management, logistics in different fields and different industry and services in the context, in the industrial context. We have these research lines. So we worked on applied operation and research logistics. We work on modeling and optimization of logistics system, different kind of logistics, as I will show you in a minute. We also have a line working on performance measurement and risk management. This is a couple of the professors work on this field. And this is the other field which I work on, which is health and humanitarian logistics. So this is our crew. We have 8 full-time professors. We have 4 teachers that hold a master's degree, and we have researchers and students from the postgraduate program. So this is our structure. I wanted to emphasize this because I wanted you to know the professors that work at the department in case you want to do some collaboration or contact these professors. Professor Carmen Patiño, she actually got her PhD here, as I was explaining to Professor Marley. She works on reliability and quality control. I work on healthcare logistics. I did most of the programs on supply chain and healthcare logistics. Juan Camilo Sanchez is a professor who's currently working on her PhD, and he's working on humanitarian logistics. He's currently studying on disaster management because it's more often to have disasters, not only natural, but also civil and political problems. So he's working on that in the United States. Professor Juan Guillermo Villegas works on method heuristics and optimization. He also has worked on location problems, supply chain management, and design, the location of facilities. Professor Pablo Maya, he works on method heuristics, and he's also working on public applications. So this is one of the fields that we have found a lot of opportunities and work to implement our techniques. Professor Olga Cecilia Usuga, she also got her PhD degree. He studied here in Sao Paulo. She works on statistics and applied statistics to industrial processes and linear regression as well. Professor Sebastián Jaén, he works on system dynamics in healthcare. He has also worked on the violence problems in Colombia from the system dynamics perspective and how the problem, for example, of drugs has implied on the social environment in Colombia. And Professor Johnny Ceballos, he works on simulation and also on system dynamics. We also have other professors that work on risk management, multivariate statistics, production and engineering, and also healthcare. I will show you in a minute the publications. And this, which is, she works on healthcare, and she actually works with a hospital. And so we have this collaboration with her. So this is our research group. Our recent experiences, we started to work more or less 10 years ago. We have had a similar cycle as you were explaining, and we started from operative decisions, which is typical logistics problems such as vehicle routing problems or facility location or inventory problems, specifically in the manufacturing systems. But then we are more working now on public systems, healthcare systems, and so this is what our experiences. These are recent research projects. So, for example, from the Colombian government, we have a lot of projects openings, and we apply in order to get resources and develop the projects. This is to study inventory systems in a specific industry sector in Colombia. The second one, they applied forecast and statistical time series analysis in order to evaluate the emergency systems in the city. So this is how often do we get hurt, how do we need to locate the ambulances in a urban area and relocate the ambulances. We also work in natural resources. Specifically, Professor Carmen Patiño, she has a collaborative work from departments that work, for example, this is all in Spanish, but this is natural resources, caucho, I don't know how you call it in Portuguese. And currently there are professors working on the benchmarking of developing performance measures in the industry in Colombia. So how are we doing on logistics performance? And the last one is also related to telemedical system, and this is when you have an emergency or when you need medical assistance, then you call and then you get medical assistance. These are recent research projects. These are recent master's theses, and we have master students working on this. This is, as you see, this is analysis of capacity applied to surgery systems in a specific hospital. This is particularly the university hospital in the Universidad de Antioquia. This was a really interesting recent master's thesis in which a student developed methods in order to respond when you have disruptions in your supply chain. So these are typical facility locations and transportation decisions, but then you also incorporate what happens when you have a disruption in your supply chain. So, for example, your network of highways doesn't work or you have a violence attack, then how you should react in order to reestablish the flow along the supply chain. In this thesis, it's also a recent thesis, we have this student working on a service area, which is airlines. So as you know, we have a lot of applications, and some of the problems and decision-making processes that you have to make on an airline services, then you can use techniques from industrial engineering. So what he did is that he developed a method to program the legs, this is the flights that you have to program in order to attend demand from customers. We also have international commerce studies, specifically from the statistics perspective. We recently had this student that developed his thesis on locating resources for the Red Cross. And this is every time you have a disaster, then how do you have to locate help in order to attend people who has been affected by these kind of events. We also work with the industry, a lot of transportation involved in this research. And we also have developed projects with the students that work on replenishment from providers and international and local providers as well. So these are master theses, and this list that I will show you is just a recent list of the projects, because we also want to work with the industry, knowing what are the problems, what are their needs. So the first one is related to education. So there are couple of professors working with the government in order to evaluate how the education is being provided in the region. So how does it help to attend social and educational needs and problems? We have a couple of professors also working on statistic processes in management in manufacturing. We have been working on urban planning processes, and this is, as we know, in Latin America, we have common problems, and this is a lot of people coming from region and rural areas, coming from urban to urban areas. And so the mobility in cities is becoming more and more difficult. So what these professors have done is that they work with the government in order to evaluate techniques and ways to improve this mobility within urban areas. We have also worked on health services in Medellin. And we also work on statistical processes applied in a specific industry. This is, for example, industry that manufactures goods for homes, such as stoves and refrigerators, and so they work with this line of industries. Some of the publications, I didn't bring all of the list of publications, but some of them, the most recent and the relevant publications, I wanted to highlight the themes, the subjects. So we have worked on home health care, which is taking care of patients in their houses. We have work on retail supply chains, and this is when you have a distribution network where you take the goods so the customers buy the goods in this point of sales. We have this Professor Villegas, working on vehicle roaring problems and different variants of the problem. So this is a strength of the research groups. Once again, we work on home health care. This is the work that Professor Sebastián Jaén has been taking on evaluating how the law has faced problems related with drugs dealing not only within Colombia, but with the United States and other countries that receive these products. And so this is a really interesting perspective from the system dynamics, how the government can react to these problems. And we also work on, this is in Spanish, home healthcare. These are another publications. Professor Maya, he has developed an important work with professors from Belgium, the university in Belgium, related to accessibility when you have disruptions, once again, in your network problem. Professor Juan Guillermo Villegas has also worked on variants of the vehicle roaring problem. We, once again, work on home health care. Vehicle roaring problems, and this is another similar problem, and this is in general taking services to the patient's houses. Not only healthcare services, but there are countries, for example, in Europe, where you have where you have children with special needs, and then you need to take teachers to their houses in order to teach them on a specific field. And Professor Usuga also works on Bayesian analysis in different industries in Colombia. So based on these experiences, we have identified that these are key research fields that we want to focus on. As we were commenting earlier, most of us and most of our professors have get their education and their higher education, doctoral and postdoctoral degrees abroad. And this is Europe, the United States, sometimes countries in Asia. But most of the time, our education is focused on solving those kind of problems. So what we identified is these are key research fields, but we want to focus that we want to do collaboration in Latin America. It's not very common that we work, for example, with people from Brazil or from Argentina or Ecuador or any of the countries. And so we want to establish this, at least give you the invitation to open these lines of work in these fields that we are focusing on. So in the public sector, we have people working on education, how to provide education to the community, healthcare services. This is very important. For example, we have a student from Colombia here in Sao Paulo, and she's developing a research project on how to deploy the network when you want to use bicycle as a transportation mode in a urban area. So how to improve those systems. And utilities. We also have the reliability. For example, when you have water supply, how to work on that, on those networks. At the agricultural sector, we have few people working with foods from other universities that we have agreements. Natural resources, as I was saying, we have professors working on the quality and the properties of these resources and their supply chain. At the humanitarian logistics, we have people working in disasters management. How do you aid people? How do you help them when they are under these disaster circumstances? And finally, at the industrial sector, we have worked on supply chain design. For example, we have worked with Colombian companies, and we want to help them, for example, to improve their export process. When they want to take, let's say, fruits to the European or North American context, we have worked on that. We have professors worked on transportation. Inventory decisions is a very common subject in the field, and warehousing, and this is where you keep the goods. Now, given these key research fields, we are using these techniques, but we are open. And as I was saying, we are evolving in our maturity process. And so we have professors that work very intensively on quantitative methods. This is statistics, optimization. But these are not only the tools that we want to use. We want to incorporate those tools in order to help improve companies in their maturity process. And so techniques as the professor uses as strategic decisions, sustainability are becoming more and more important. So we are open to use these tools as well as the tools we use. These are some opportunities. So currently, Universidad de Sao Paulo has an agreement with Universidad de Antioquia. The agreement has been held for almost 10 years. We have students from Medellin and from Colombia that come to the department. We want to intensify this mobility of students, but this is only for now at the undergraduate level. We want to offer you and explain that we have opportunities for master's degree because we have a lot of research projects going on. We have a lot of industry asking for help at their specific problems, and I know that you also work with the industry, and this is a strength for your university. We only have PhD students by collaboration, and this is professors that have developed their PhD and their research projects abroad. And so what they do is that they have collaborative work from professors in other countries, and so we have PhD students. And this is also something that we want to keep open because you have more experience than us with the PhD program. Okay, now finally, I'll just want to show you some applications that we have done in home healthcare. Have you heard of home healthcare? This is specifically, this is, it appears more or less in the 50s in the United States, and it's a way in order to reduce some of the expenses that the healthcare system has when you have to take care of patients. So it appears originally in New York, but then it was used in different countries. The objective originally was to reduce the congestion in hospitals. However, we found that different countries have different policy statements and different policies for financing healthcare, and it's a growing sector in the medical system. So the way it works is based on a delivery network where you are hospitalized in your house. So even if you have had a surgery or you need to take a therapy at home, then the medical service is taken to your place. One definition on a delivery network is this one, based on the Barnes report. This home health care, as the acronym goes for home health care, is a service network where you have the patient, obviously the person that you need to take care of, the family, the hospital and the physician or the medical doctors. Then you have the people involved in the logistics implementation, and this is where we can take part of the decision. We have the financial aspect, and this is very important because we have different ways of paying or receiving healthcare in Latin America. And the home care team, and this is the nurses, the physicians, and the therapists. Now, given this perspective, what we did is that we developed a framework in which we identify for each of the planning horizons at the operational, the very daily, day-by-day decisions, tactical and strategic levels. We divided and we wanted to identify different logistics decisions. And this is the network design. This is the urban area. How do you plan your urban area? Transportation management, the staff management. These are the physicians and all the people involved taking care of patients. And inventory, because you need to have equipments, medical, and supplies. Down here, what we have is the service processes, and these are the processes that you provide for patients, for medical services, and the support services that give support to the framework. So this is intentionally done here in order to differentiate some of the decisions. So don't be scared. This is not really, it's actually really easy. So this is the network design. We have where to locate facilities in order to take care of patients, but you're taking care of patients at their houses. So you need to, for example, in a city such as Sao Paulo, which is a huge city, I think it's more than 20 million people by day moving in the city, then you want to allocate your people in order to take care of patients. In the transportation management, one of the common decisions is what transportation modes are you going to use? Are your medical doctors going to take the metro, or are they going to go by car or by taxi? And the sequences of visits. This is a common problem in the literature. Now, in every healthcare system, as I will show you in a minute, nurses, medical doctors are one of the most expensive resources. So you need to manage those resources carefully because that also depends the quality of the service that you provide. And finally, at the inventory management, if you use third-party logistics in order to provide devices or medical devices, then you need to select those providers, define inventory policies, and control your inventory. Down here, we have the common cycle that goes on when you use this service. You have a medical prescription in general. Then based on that prescription, there is a patient admission. And then you have a medical follow-up during the process. Once you are admitted to the system, then you have an appointment scheduling that say, I'm going to go to your house Monday, Wednesday, and Friday to give you to provide you the care system, the care service. Then we have an administrative tracing, and at the end, based on a medical perspective, then you have a discharge or you re-enter once again if you get better from your health issue. So what we did is we identify relevant problems not only in the literature but in the context, in the regional context. So the districting problem is an important issue. I will show you in a minute what the problem consists of. This is really important given the relevance on the finance structure of the companies. And finally, this is a problem studied in the literature. So the first problem, I will just give you an example and a graphical representation of the problem. This is, you have a large area, a urban area. Any of the cities in Latin America is growing. Some of the literature that we studied says that more or less 79% of the population in Latin America is moving from rural areas to urban areas. And this generates a lot of social problems because most of the people live in the around the city. And so we have social issues, we have health issues. So the problem is how to divide the city in order to provide a good service. I don't know the structure of Sao Paulo, but let's say that we want, if I'm a nurse, I want to move in a small area so that I spend most of my time taking care of patients, but not moving among the patient houses. So the problem is relevant because it partially determines the quality of the service that I will provide. It allows to maximize the time that I spend taking care of patients. And if you are hospitalized in your place, you want two persons to be on time and preferable the same person to take care of you, of your relative. Some of the issues is, this is, as we call it, rapid growing cities. This is very common in Latin America specifically. In Latin America, we have the highest ratio of people moving to urban areas, so this is relevant. There is an increasing demand for health services, not only on the quantity, but the diversity. So we are getting ill of different illnesses. These are some of the works in the literature that have studied the problem. We have in different contexts. This was in Canada, this was in Montreal, this was also in Canada, this was in the United States, and this was in France. So graphically, the problem goes like this. Let's say this is an urban area. Each of the neighborhoods or zip codes or small areas in which you divide a urban area, you have a population, you have demand requirements according to their illnesses. You have an area that you have to cover, and this is the specific risk that we model. And this is, in Colombia, we have a lot of cases in which you cannot move just freely from one neighbor to another one, because there are social problems, there are violence attacks, and so we wanted to quantify what is the risk of a nurse going to a specific neighborhood. So we did that, we modeled that. Each of the basic units have a patient. This is another class of the problem. Each of the patient has a different pathology and a different medical treatment, and medical treatments are composed by medical activities that require a specific specialization of a medical professional. So each medical staff has their abilities, and the question is how to assign this medical staff, these are the decisions, how to divide a large area in order to maximize the time that you spend with patients. For this problem, we used quantitative methods, but we also worked with a real company in order to identify critical factors, social factors that wanted to be involved in the decision-making process. This was applied. This was one of the applications. The other application is the problem of the staff management. It was very curious that we wanted to work with these companies, and so we went with them and we had interviews, and we asked, well, what are your problems? What are your needs? What, from the industrial engineering perspective, can we do in order to help you and improve the service? And one of the first things that they said, it was this. It was, the service is growing, demand is growing, people are getting sicker and sicker. The government has a pressure on the companies that offer these services. And then you have a lot of law involved in the process. But then for us, the management of the people is difficult. In the literature, this problem in the healthcare systems is identified as one of the most expensive and delicate problems on a healthcare institution. The problem is relevant because it refers to the efficient but effective assignment of nurses, medical doctors, therapists, and the different quantitative or experiences that the medical professional have. Now, maybe you have heard the expression of the or the list of the rights in supply chain management. This is the right product at the right time. We have the same thing for staff management. And this is the goal of any staff management system, is to ensure that the right people, this is if you need a physical therapist, you don't want a nurse, because the nurse doesn't have the abilities that you need for the physical therapist. So the right people are available at the right place. This is your home at 9 a.m., no at 3 p.m. See? The right times to incorporate and to have high levels of quality in the service. Some of the issues in Colombia, but not only in Colombia and Latin America, we have longer hours of work, as the policy says. But it has been showed that scientifically, from the medical perspective, that if you are a nurse and you're working more than 40 hours per week, then the risk that you make a mistake taking care of a patient grows exponentially. So it is dangerous when you assign a nurse or any medical professional to work more than 40 hours per week. And also we have the learning curve phenomena, because once you become an expert doing something, then you do it better. These are some of the works in the literature that study this problem, and graphically it's something like this. We have a period that is a year. The last decision, it was a long-term decision, but this is more a tactical decision. So we have for each of the 12 months of a year, let's say, we have the number of staff that you need to hire, to lay off or to let go, and then the current available staff. So the decision variables that we incorporate in the problem were how many people to hire, how many people you have from period to period, and then how many people do you need to lay off. It is important to notice that this has a social effect, not only on the people that you're hiring and let it go, but also on the patients. So because we performed the model for a period of a year, then we were able to balance the system. So we were not hiding and let it go as many people as the real system was. So we show that they can improve these decisions using some of the quantitative techniques mixed with qualitative techniques. Finally, the last problem, which is the most common in the literature, is related to a vehicle rodent problem. Maybe you have heard of the problem. And this is you have to take care of a set of patients that are geographically dispersed in a urban area, but you need to take care of at specific times. So this was the problem. We wanted to define a sequence of visits within the times. Some of the characteristics, then we have each of the patients located at a different geographical location with different characteristics and skill requirements. We have the medical professions that was a group of people that were able to provide the services located at different geographical locations and with different skills. This is the problem that has been studied the most in the literature. So these are some of the relevant work in the literature, but we have more than 20 and 25 people working on the problem. So this is just a representation of the problem. So let's say you have a medical treatment. You have a set of patients geographically dispersed in an area, in a urban area, and you have a set of medical activities that you have to sequence in order to provide the service on time. So this was the planning process. We have to assign the staff to perform those services, and we need to sequence, so to provide the sequence of the visits for the patients. So these were the decisions, and we apply this also with real data. However, we haven't been able yet to work together with companies to implement these tools. So this is a challenge, and this is the gap that we want to fulfill, because we want to work together with companies. So as a conclusion, I want to thank for your attention, because this is just some of the applications. But specifically, I want to invite you, because this is an open invitation for you to know the program, to know the university, so you know that there's already an agreement with the Universidad de Antioquia, not only you, but your coworkers, if you know people that are interested in this kind of tools. because as we were saying, most of us have studied abroad, solving problems from other countries sometimes. But in Latin America, we have common and specific problems that we can share tools in order to improve our sustainability as a region. So, as maybe you've heard of Gabriel Garcia Marquez, which is a writer, he says, when he received his Nobel Prize, and maybe you heard of him, in 1982, well, yeah, in Europe works okay, in the United States works okay, but in Latin America it's different. So we need to focus on our own problems. So thank you very much for your attention, and if you have any questions or comments, I will be glad to answer.
Thank you, Valentina, for your presentation. For sure, we have some common interesting point. I think we can work together. As we start a little bit late, I have time for just one question during the transmission, but after that we can talk for sure as long as we think it's care the professionals from this stress, and how do you deal with the competence of this kind of professional, because it's totally different to receive the doctor on the hospital and the doctor goes to your house. It's totally different. The way the doctor should approach the family and the patient is totally different. So I'd like you to discuss the more soft side, the competence of the group, and how do you deal with the stress if you try to understand this kind of program in a huge city like São Paulo.
Thank you. As I said, home health care is only one of the applications that we have worked on. It's one of the health services. And from that perspective, we haven't applied yet those kind of studies. So first, we focused on part of the quantitative way to support logistics decisions. However, we found when we were working with the companies and the medical doctors specifically, they said, well, this is more difficult for me because it's easier if I just stay in my office or my consultory and then patients come to visit me. So because of the craziness of the traffic nowadays in our cities, what we did is that we incorporated a measure of the time that they need to spend on traveling between patients' homes, and also in the learning curve phenomena. Because they said, well, it is different if you work within a hospital, within a facility, than within an urban area. We haven't used yet those techniques or any kind of techniques to approach to the social or, as you were saying, the softer part of the problem. But currently, we are actually starting to develop in a project with the hospital from the university. In this, because some of the professors have experiences working with them, currently working, and we want to work with Professor Sebastián Jaén. What he does is that he evaluates the system from a more wider perspective, and this is from system dynamics. And so in system dynamics, it is easier to incorporate the stress that the staff or the medical staff has to face during performing their job. We haven't done it yet. We haven't searched for in the literature yet for that field of or that kind of side of the problem, but it is something that we know it affects the system, because once you are under stress, then the quality of the service might change. Mm-hmm. Yeah, but as I was saying, this is only one of the applications. Other master students and professors have worked on, for example, the location of the ambulances. And this is, in Colombia, is very, the healthcare system is under a lot of pressure, not only for the government, but also for the media. We have all of the time news and newspapers saying this hospital is not providing the services it should. And the emergency systems is under attention most of the time, is in the spotlight. So we have these master's students working on the location of the ambulances when you have to attend emergencies, but also in in the behind decisions that you have to make, and this is how many resources do you have to locate in order to provide the service of the ambulance within 10 minutes, for example. So something that we have clear is that there are a lot of applications and problems that we can solve, but also we have clear that as an industrial engineer, we don't have all the tools in order to study these complex systems. And this is when we identify interdisciplinarity. So this is what we need to work with medical doctors. Sometimes we work with anthropologists because we want to know the effect of the social service, how it is provided. And this is something that we want to be open to incorporate different fields of knowledge, not only engineering. Mm-hmm.
Valentina, thank you so much for your presentation. Oh, thank you so much. Bom, agradeço aí a participação de todos. A gente vai fechar agora o link, né? E a gente espera vocês. O próximo mês é férias, mas a gente volta no segundo semestre com mais apresentações para vocês. Muito obrigada. Até logo.